AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, presented by AMP2 TV and also sponsored by All County Healthcare. It's a pleasure to have you here tonight. Thank you for joining us. Just so you know, you can watch us live on allcountyhealthcare.com. It's streaming, video streaming, so you'll be able to see us live. And also on AMP2, the number 2.tv. Look for You and Your Doctors. So I'd like to welcome you again to our show tonight. As you know, we would love to have any questions that you might have. Our telephone number here is 888-565-1470. I would love to introduce our guest. I just want to say again, thank you so much, All County Healthcare, for sponsoring our guests and helping all of us to become educated about what is available to us and being able to make the right choices. Because at All County Healthcare, patients are the heart of their business. So I'd like to welcome today Miss Leslie Curtis. Hi, Leslie. How are you?
I'm good. How are you?
It's great to have you here tonight. And you are from Regents Park of Boca Raton.
Yes, I am.
So tell us a little bit. Where is it located? How do they get a hold of you? And what is Regents?
Regents Park of Boca Raton is a skilled nursing facility. So we offer short-term rehab and long-term care. We are located at 6363 Verde Trail in Boca Raton. Mm-hmm. We are right next to Verde Elementary. It is a residential neighborhood. If you don't know we're there, you probably don't know we're there because it's kind of tucked away. We're off the road quite a bit. We have beautiful gardens and trees. And
oh, that sounds fabulous.
It really is. It's a lot of nature.
I like that because you know something, what's so nice is the ability of having that feel of home. And, you know, a lot of residents that either are just rehabbing or coming to your place, they love that feel of nature. It's so refreshing and it's so healing.
It really is. You know, there are several gardens that they can go out to, you know, in between rehab. And if they live there, they can certainly go out there all the time. We have 180 beds. Wow. And right now we have, I think, 74 short-term rehab beds, which means Medicare insurance, different insurances. And then we have about 110, 112 long-term beds, which are duly certified Medicare and Medicaid.
Oh, okay.
Because most patients, even if they come in and start with private pay, generally they will end up long-term Medicaid.
Gotcha.
So, and people are always so surprised that Regents Park takes Medicaid, but we do.
Yeah, that is unusual.
Yeah.
I'm a bit familiar with a few of the homes that are out there, and that is really unusual. That is wonderful.
It is a beautiful facility. It really is.
Yeah.
We've been there for about 32 years, and the current owners for about 30. It is family-owned and operated.
Wow.
Yeah.
Wow,
so,
that's really unusual.
I know. It is such a pleasure to work for family-owned and operated because if you have any issues of any kind or want to make changes, it's a whole lot easier to do that with the family-owned and operated instead of having to go through a corporate entity, which you know yourself can take.
Oh, yeah.
Longer. By the time
it's called red tape, isn't it?
Yes, it is.
I thought so.
By the time you resolve whatever you want to resolve, it's like a moot point.
Yeah.
So
okay.
It's really nice.
Tell us your phone number so we can get a hold of you.
The phone number is 561-483-9282. I'm at extension 2407, and I'm almost always there.
Okay. 2407.
Right.
Okay, guys, write that down. Okay.
So you can get me. whether it's with questions about coverage or questions about rehabilitation. We get a lot of patients that will call us prior to surgery.
Oh, okay.
Yeah, which is the best way to do it, because then we can almost insure a bed even in season. Believe it or not, there's a season to rehab. So,
Well, that's interesting. Share that.
there's a season to South Florida.
Well,
So the snowbirds go home, and there's more availability for short-term rehab beds.
gotcha.
During season, you have people coming in that even, live here 6 months, but they're in there with the flu or they're in there with this or that.
I got you.
So, if you're going to plan a surgery, do it from August through October.
If you have that choice. Yes.
Right.
Exactly. Okay.
And actually, some of our, joint replacements do plan it for those months because they know they'll be able to get in.
Gotcha.
Yeah.
Oh,
So
okay.
it works.
Wonderful. Wonderful. So you said that it's been there you've owned it for 30 years?
About 30 years, yeah.
Wow. So it's well established.
Oh, yeah. Yeah. And originally, it was mostly long-term care, but now they have actually, probably in the last 12 years, added the 60-bed short-term rehab unit.
I see.
And
Okay.
we've just renovated all the long-term care beds as well. So they all the beds look the same.
Wonderful.
Well, it's great because if somebody is there for short-term rehab and they realize they cannot go home, to send them then to a long-term bed, the rooms look the same. So it's much easier on those patients with some cognitive deficits or,
Oh, okay.
the rooms look the same.
Excellent.
Yeah.
Excellent. Now, what varieties of issues are you dealing with then? I mean, because I'm familiar with the short-term rehab and then also independent living, assisted living. What does your facility offer?
Long-term care, besides the short-term rehab, long-term care is for those patients that can no longer stay in their own home, either for financial reasons or just the care that they require. So we have 24/7 nursing for both short-term and long-term care,
Wow.
which means that if a patient, and they really are prone to like urinary tract infections, we're on top of it because we start to see there's a little change in their cognitive issues or things. So the nurses are on top of it, where if they were at home, maybe even with, a 24-hour nursing assistant, they're not going to catch it as fast as we do.
Gotcha.
So we can run the labs, we can do the things that need to be done so that we can avoid hospitalization,
Excellent.
which is very disrupting to any patient that's there for long-term care and maybe has some cognitive issues.
Yeah.
They end up in the
Yes.
hospital. They don't know where they are. They don't know what's going on.
Yes.
So we can avoid a lot of that with just the ability to run the urine, to run the, have a stat chest X-ray done or things like that. We can monitor them much closer than if they were in their own home. And the other thing that I think is really important to understand is that those individuals that need to be in a long-term care setting, maybe they could stay in their home. Maybe they have the resources, but they don't get the socialization.
You're right. It's a very isolated
Yes.
space. And especially if they can't drive or they don't have neighbors that come over and
Right.
visit. Yeah.
So they might have, even a 24/7 aid, but they don't have the activities. They don't have the things that really motivate all of us to be involved with our life.
Right.
We're at Regents Park. We have a full activities calendar.
Oh, that's fabulous.
Yeah.
Yeah. Well, something, that's what health and well-being is all about, is, having the ability of the activities to be able to feel that sense of accomplishment.
Right.
And it's so important for not only the cognitive and the mental, but also the emotional.
Right.
And to have people together as well,
Right.
creating that socialization, it makes them feel as if they belong.
Well, today we had Clown Day. And,
Right.
mostly the long-term residents participated in the activities, certainly things like that. They had on their clown ties and clown noses and clown hats.
Adorable.
So they, had a party and they had a great day.
I love that.
We'll probably try and get some of those pictures on our
Your
Facebook page.
Oh, Facebook.
Yeah.
Oh, well, give us your Facebook page.
It's
so that we can look at it.
It's Regents Park. Oh God, Regents Park Boca. Facebook Regents Park Boca.
Is it?
It should be on there.
Okay, let me see here. Facebook.com//Regents Park Boca Raton.
Yeah, there you go.
Okay, excellent. Oh, my God, that sounds so much fun.
It's they really have a good time.
Oh.
During Walgreens Red Nose thing.
Yes.
We had so many residents walking, wheeling around.
Yeah, I walked around with the red nose. Yes.
Right, we had Red Nose Day. So they do a lot of things. They have a cooking class, I think, every other week.
Nice.
Live entertainment 3 to 4 days a week.
I used to sing at some of those homes.
They have happy hour twice a week.
They have happy hour?
Oh, yes, they do.
And what are they serving?
I think mostly beer and wine. I mean, obviously, we're not going to give them a bottle of wine. And the staff knows the residents, so...
Yeah. They know, and sometimes it's just grape juice, right?
Yeah, well, yeah, for those that need that. So they have the happy hour.
I love that. That is so cool.
And that's packed.
Oh, I imagine so, yes, because that's really, that's the feel of home as well. Before dinner or during dinner or something, to have a glass of wine. Oh, that's wonderful.
And they have the ice cream parlor. And there are several residents that will bring in for their parents, a glass of wine. They'll sit and play cards.
Oh, nice.
So they do actually do a lot. We've got 2 residents that activities will work with them to cook their Italian, so they cook meals.
What time is dinner? Can I come?
Yeah, and they really enjoyed because it's what they love to do. One of them had a restaurant in the past, so yeah.
Oh, that is excellent, and not only that, the ability of being able to do that. What a freedom that is,
Yep.
Because a lot of the places that I've gone to, it's very controlled,
right?
And there's nobody going into the kitchen at all. So,
right. Well, we have a little kitchenette, kind of like in the activities room. So one of the activities gals will work with them to cook the meal and prepare, they love it.
Yeah. Oh, that sounds amazing.
Yeah.
So I just like to take this time to say thank you so much, All County Healthcare, for for sponsoring this. A lot of times individuals, they don't know that this is available to them.
No.
So, I mean, this is fabulous for you to be able to come in and educate us and let us know that something like this is open and available, because most of the time, and not only that, Medicaid and Medicare, that's really unusual.
It really is nice because, first of all, for our long-term residents, like I said, a lot of them are Medicare, Medicaid.
Mm-hmm.
So if they do end up, for whatever reason, going out to the hospital and they come back, they'll probably qualify for short-term rehab.
Mm-hmm.
They don't have to go into a different bed. They can stay in their bed.
Yeah, that's
in their
very
room,
cool.
and get their short-term rehab to bring them back to their prior level of function. So,
wow.
Yeah, it is really nice.
That is wonderful. So what is the process of admission then, to be admitted? I mean, what criteria do you use?
For short-term rehab, most of them are Medicare. Some are insurance. But they need a 3-day qualifying stay, 3-night, I should say, qualifying stay in a hospital. And then Medicare does pay for short-term rehabilitation. Well, as we all know, the stay in the hospital is very short.
Yes.
So patients that may have been sick for a day or 2 or 3 prior go to the hospital. They're usually debilitated. They need a tune-up, so to speak.
Mm-hmm.
So they come to us, we get them back to their prior level of function, send them home.
Mm-hmm.
If it's a joint replacement or an arranged surgery, I always tell them, call us the night before you go in so we know that you're really going in, nothing's been canceled, and then we can almost assure a bed for them, even during the heavy-duty season time like we talked about.
Mm-hmm.
So, we know that on this date, they're probably going to be discharged, and we'll be looking for that referral from the hospital.
I understand.
And then for long-term care, I truly recommend that people start looking before they need it, because we're often full in long-term care.
I would think so. I would think so.
They have to, if they know within 6 months they're going to be looking at something, they need to call us now.
What are some of the signs that they should be looking for in order to understand that they might need some of this?
I would say looking at their loved one and functional decline.
Okay.
Whether it's cognitive, physical. Usually you see both. And a lot of times the cognitive is really more of a problem because they're depressed. They can't do what they used to do. So you see a debility happening. You need to start looking around then.
Okay.
Because if they're more appropriate for assisted living, I'd be the first one to tell them, maybe they need a memory care unit.
Okay.
Or they need assisted living. There's all kinds of different assisted living. So, even though, yes, we want to fill the beds, we don't want to fill it with someone that would be better served in a different setting.
Exactly.
You always want somebody...
You want to meet the needs of the patient.
Right, functioning at their highest level.
Gotcha.
So, it's really, once we can evaluate the patient, we can really tell them, you probably are going to be looking at, to best serve your loved one, assisted living. Or, no, they really need skilled care.
Gotcha.
So, it really is a process, especially for the long term. But it's certainly better if they contact us sooner than later. If you call us on Monday and want placement on Friday, it's probably not going to happen.
Oh, my goodness. I wouldn't think so.
Yeah.
So you have to plan in advance.
You do.
And you plan that based on the level of functionality that the individual is currently at and whether or not there's a decline or not, correct?
Right.
Okay, excellent. Well, let's talk about the insurance piece of it. Because you did say that you accept insurance as well.
Right.
And what do you know the various insurance companies that you accept?
We work, and this is mostly for short term.
Okay.
Care Plus, Aetna.
Okay.
TRICARE is usually the secondary to Medicare. A lot of secondaries to Medicare.
Well, that's what I was going to ask as well, what the secondaries are that you accept.
It's amazing. We accept almost all of them because when Medicare is primary, they don't really care. But a lot of people have taken their old insurance from when they were working and converted it, not to a supplement, but it's still like a PPO.
Oh.
And then their benefits are different. For Medicare and short-term rehab, the first 20 days are covered at 100%.
Okay.
21 to 100, and most people do not get 100 days. There's a co-insurance that Medicare does not cover no matter where you go of 161 a day.
Wow.
Yeah.
That's
so
expensive.
If you have a good Medicare supplement, it'll cover it.
Okay.
If it's one of those converted PPOs and they're now secondary to Medicare, often there's like a 30% copay or a deductible and things like that. So it really varies.
Okay. That's really good information to know because many times they're caught off guard because they don't understand the whole insurance process.
No. And it's a slip and fall. Now it's a fractured hip. They've had surgery and they don't even have a clue.
Yeah.
And the daughter in some other state is trying to manage her parent, doesn't know what they have for a secondary. So as soon as we find out that information, we will verify it and let the family know if it's not covered or if there's a higher copay.
Oh, that's wonderful. That's wonderful. Yeah, because I'm somewhat familiar with the medical field.
Yeah.
And the secondaries, the individual accepts the Medicare, but all of a sudden doesn't accept the secondary.
Right.
And the patient's caught off guard. It's like, well, wait a minute, though. That's why I have secondary to cover any other charges.
Yeah.
So.
And they really think in their heart that it's all going to be covered when it's those kind of strange policies,
Yes.
It's not. There's usually a higher copay.
I see.
Yeah.
So what other types of therapies or whatever are offered within your facility?
We have physical therapy, occupational therapy, speech therapy, 24/7 respiratory therapy. We do accept patients with trachs.
Oh my goodness.
And not ventilators, but trachs.
Uh-huh.
And the goal is to get them home with the if we can't get them off the trach, the goal is to train the family to go home.
Gotcha.
So patients with laryngectomies, certain surgeries, they're not going to lose that trach.
I gotcha.
So the goal is then to train the patient, which usually the patient, if they're alert and oriented, can learn how to do the care themselves and the family. Frequently, those kinds of patients have feeding tubes. And so we need to train the families on how to deal with the feeding tubes because they may keep them forever. They may eventually get off of them, but you don't know right off the bat. So it's a lot of coordinating with the family and meeting with the family prior to admission on those kinds of patients as to whether they will be able to actually deal with it.
Gotcha.
Yeah.
Gotcha. Excellent. Excellent. Well, I love the fact that you give a lot of backup support to the caregivers as well. That's so essential because many times they're so caught off guard. And not only that, it's a lot of times they're busy working as well. So,
Right.
They're busy trying to balance family and then learning how to, be a caregiver.
Right.
And family again, and then their work. And so it's quite a balancing act.
It is, the sandwich generation. They've got children of their own. They're trying to deal with their families. They're flying in from New York or wherever. And it's very tough on them. And a lot of times they really had no idea because, if you talk to somebody with mild cognitive deficits over the phone, they can fool you. And they're so surprised when they fly out, because mom's in the hospital and they see the apartment and they realize, uh-oh.
Yeah, we have a problem. Houston.
Mom was not handling, because they can give you any answer you want to hear.
Right.
And then
They're smart enough to do that.
Yes, they are. And they realize that mom should not be living alone. And a lot of times it really is assisted living that they need after rehab, but they really don't know a lot of times the impairments that have been there.
Yes.
So it's always interesting.
Yeah. Maybe even a little scary or frightening too
For them.
For them. Yeah,
Yeah.
to come and take a look to see what their parents are going
Right.
through.
And it's, usually it's mom or dad is a widower. They're living alone. Kids think they're doing fine. They're not.
Wow.
So, you have to deal with the denial.
Yeah.
Well, mom was fine. No, she wasn't. Look at her apartment. She has the heat on, and it's summer.
Yeah, it's 90 degrees out,
Right.
especially down here.
Right. So
Oh, goodness.
it really gets tricky.
Yeah. Yeah, it's a tough. It's difficult because the children are up and raised and they're busy, dealing with their own families.
Right.
So they don't necessarily have a lot of time to come back and to double check and make sure
Exactly.
that they're there in the physical.
And the kids are
means.
tag teaming.
Yeah.
One's flying in from New York. When they leave, the one's coming from New Jersey. The other one's coming from Las Vegas. And,
Wow.
they may not agree on things because none of them were aware
Yeah.
of the real situation. So it gets tricky.
Yes, I would imagine so. So, are there any other consultations that you offer?
Oh, yeah. We have,
Yeah.
Oh, yeah. You have to. You have to. We have 3 physiatrists that come.
3 who?
Physiatrists. Those are doctors
Okay.
of physical medicine.
Okay. All right. Thank
So-
you for,
Yeah.
explaining that.
So they come on the patients that need that. We have psychiatry, psychology, podiatrist.
Wow.
We have the eye doctor that comes in. Usually that's more for long term, but sometimes for short term. We have a neurooptometrist, Dr. Lampert, who's wonderful and really has done great work with a lot of our patients. A lot of our frequent fallers
Oh, yes.
have some peripheral vision issues or, different visual issues that he can work with, and boom, they're good as new.
Wow, that's
Yeah,
excellent.
so it's a I mean, I've seen him with a patient that hadn't read in 5 years because the
Really?
words were blurry,
Uh-huh.
And after, he showed the therapist what to do with him, he was in the middle of a 500-page book.
Oh, my gosh.
Yeah.
Oh, my goodness.
Because
Oh,
he was able to. So quality of life.
Yes, absolutely.
And that was a short-term rehab patient.
And you know something? I'm a firm believer. If you have quality of life, you'll have quantity of life.
Right.
So that is absolutely wonderful.
Yeah.
So I would love, please, if you have any questions whatsoever, please share your telephone number, how to get a hold of you, Leslie, website, emails. Go ahead.
Yeah. 561-483-9282. I'm at extension 2407. The website is regentsparkbocaraton.com. My email is lcurtis@regentsparkboca.com. If you're on our website, it says contact us. That comes directly to me. So
Okay, great.
Either way, that's probably the easiest way to get me. It comes to me, and unless it comes to me at 10 o'clock on Sunday night, I probably won't answer till Monday morning, but we try to answer promptly.
Oh.
And let's see. I think that's it.
Well, I can't thank you enough for being here, informing our audience, our listeners about how to contact you, what's available at your facility. I just get this real feel from you about deep care and compassion for your patients, for your clients. So I really want to commend you and thank you for being a part of our show today. And please, by all means, if you have any questions for Leslie, please give her a call.
Please call, and you can come for a tour at any time.
Oh, excellent.
You don't have to arrange an appointment. We're there 24/7.
Excellent. Well, thank you so very much.
Thank you.
And we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. This is You and Your Doctors. I'm Lorena Anderson, your life and energy coach. And tonight is being presented by amp2.tv. You can watch them live streaming on their website. And also being sponsored by All County Healthcare. You can also watch live streaming on their website, and that's allcountyhealthcare.com. Please also, this is very participatory. I know that's a big word, but we would love to have you call. If you have any questions whatsoever, please give us a call at 888-565-1470. So I'd love to welcome our next doctor, our next guest here on the show, Dr. Escobar. And he is going to share with us his expertise and special abilities and what he has been working on for quite some time now. Correct, Dr. Escobar?
That's correct, Lorena.
All right.
Thanks for having me on. It is a pleasure to be here and to see you again. And I would love to explain to your listeners, the millions of listeners, I should add.
Yes, the millions of listeners,
Yes,
absolutely.
What we do at our office in Hollywood at Pain Care Specialists of Florida, we practice pain management and help patients who are suffering from acute and chronic pain with interventional treatments in the way to help with the symptoms. And lately, in the last few years, I have incorporated what is called regenerative medicine into the practice. And by doing this, we are trying to help our patients to regenerate from their injuries and not necessarily treat only the pain.
I see. Okay. So tell us a little bit about what is involved in regenerative medicine.
Basically, we are trying to enhance patients' own prowess of healing. You know, we all have this signaling process whenever an injury happens to our bodies. All this process commences with there's messenger signals go to these stem cells that exist in our own body, and this produces some inflammation that attracts all the cells to the injured area to try to heal. In most instances, when the injury is not too severe, the healing process takes along and heals the injury. Sometimes there's not enough material to heal that injury, and that's where regenerative medicine comes into play.
Okay.
We basically go get those cells from the patient. These are all autologous cells. We harvest the stem cells from the patient, process them in the lab, and inject them in the injured area very precisely on the direct visualization, either by fluoroscopy, which is real-time X-ray, and or under sonography, which is ultrasound-directed injections to the injured areas.
So that's really interesting. So you end up harvesting the patient's stem cells directly from them. And then what, after you take the stem cells, what exactly is it that you put together to inject back into the injury?
What's in the soup?
What's in the soup?
Yes.
I was going to say that, but I was like, okay.
Well, there's two parts to this. One is the stem cells themselves, what we like to call the repairman.
Okay.
Stem cells are cells that exist in most tissues in the body. Most commonly in bone marrow and adipose tissue. We harvest those cells and clean them up, separate them from all the other tissues that do not benefit in the healing process, and as a matter of fact, can cause more inflammation. Take those away and separate the stem cells.
Okay.
The stem cells, like I said, we call them the repairman. Then after we have separated those stem cells, we extract some of the patient's own blood, process it as well, take away the tissues and cells that we don't need, such as the red cells and the plasma, and just obtain what we call the Buffy code, which is a concentration of the patient's own platelets and a little bit of the plasma. That will serve as the tools that the stem cells, or the repairmen, if you will use to repair the damaged tissues. So we mix them together and re-inject them into the area where the injury has occurred.
So what would be a normal place that you would be retrieving the stem cells from? Because you said you're taking them out of the bone marrow. Is there a particular place that you might be taking them out of, or does it matter?
Well, it does matter. Pretty much every bone has bone marrow. The larger the bone, the larger the amount of bone marrow. The most common areas is the pelvis, and we can extract the the bone marrow from that area. Some surgeons, when doing surgery, extract the bone marrow from the femur or from the tibia.
Okay.
Sometimes the bone marrow is extracted from the other bones, depending where they are working at. We tend to use the pelvis area because it's very abundant on the bone marrow. We can also use the adipose tissue via an extraction that is called liposuction. In this case, it's a mini liposuction because the amount that is extracted is much smaller than the amounts that are extracted during the cosmetic liposuction, which is the most common procedure.
Right.
Most known procedure, I should say.
Yes.
In the cells, mesenchymal stem cells are in both tissues and they're separated. That's the easiest to retrieve. But the stem cells exist in any other tissue in the body, in the teeth and the skin, kidneys, the liver.
But it all depends on how much you need it, whatever the injury is.
That's correct.
The amount that you need.
How you harvest them without causing any damage to the patient. And those will be the two areas that are the most common and safely harvested.
I see. So how long does it take then for the marrow to regenerate after you've removed some of that marrow out of there? I mean, I'm thinking about the extraction of the bone marrow. Does that leave the bone itself fragile?
Well, no, it does not. It does not. I mean, this is not harvesting any bone cells per se. The bones are hollow tissues, if you will. So that's where the marrow exists. The outside of the bone still stays intact. And the bone marrow will regenerate, and again, as a healing process, will transfer from one area to another to try to fill the void.
Gotcha.
The amount extracted is not that much to really create any harm.
Okay. What are some of the injuries that you would use the regenerative medicine on?
Basically, the regenerative medicine can be applied to any tissue or any injury or any disease, if you will. We specialize in the musculoskeletal system, and that's what we treat. We treat muscles, tendons, bone, any injuries in those areas, the spine, shoulders, knees, hips. And
does it help with the pain then?
Yes, it does. It's two processes. The stem cell treatment has an anti-inflammatory effect, which gives you some almost immediate result on the inflammation and on the pain part. The regenerative part is much slower process and may take several months to occur, but the symptomatology improves a lot faster than any regenerative process takes place.
Well, that's really interesting too, because I was, wondering how, what it was within the soup, as you called it, that would stop the pain from the injury. So that was very, very interesting.
Well, to answer your question in that regard, there's a bunch of cytokines that we call. There's a lot of growth factors also included in that soup. A lot of different chemicals that do help in the inflammatory process early on before the regenerative process takes place.
Understood. Okay, great. Excellent. How many injuries have you been dealing with now with this particular type of regenerative medicine?
Well, we've been dealing with many injuries. I mean, I practice exclusively pain management. So all of our patients have some sort of injury.
Do they all opt for the stem cell?
Not all. Unfortunately, these stem cell treatments are not covered by traditional insurance.
Oh my goodness!
And so it's not something that we can integrate under the normal algorithm that we use on every patient. We treat our patients with our traditional algorithms, and if this is either not fast enough or not helping enough, then we offer our patients the alternative of stem cell treatment. And it will be a patient's choice, and obviously it has to be covered by the
The
patient
patient themselves, yeah.
not by an insurance carrier.
And how many treatments does an injury? Give me a good example of an injury and the amount of treatments that it might take.
Well, let's take a common injury. Let's say in the shoulder. One of the most common injuries you've heard patients complaining or friends complaining. Oh, I tore
Rotator
my
cuffs,
rotator
huh?
cuff.
Okay, yeah.
There we go. And this is a very complicated, complex set of tendons and muscles that help move the shoulder and the arm. One of the tendons, the supraspinatus tendon, which is the tendon that helps you raise the arm on top of the shoulder itself, is the most commonly injured. And we have had very good success treating injuries. Partial tears of the rotator cuff of the supraspinatus tendon.
Really?
Yes, ma'am.
Wow. Because the only time that I've ever known anything of that nature, you cannot, it doesn't repair itself. You have to go in and have surgery. So that's...
Well, it will repair itself. It all depends on the injury itself. You know, if you do have a partial tear, it's a very small tear, that probably will heal by itself. If you have a larger tear that is either taking too long to heal, or the patient is a very active patient or athlete, if you will, that wants a faster healing from the injury without having to go through surgery, that would be an excellent candidate. And that will shorten the healing process that would have taken place or might have not been enough to be healed without the added stem cells and platelet-rich plasma to it.
That is very, very interesting. Because, I had one of my friends that, and I work out all the time anyhow, so I had one of my friends who was at the gym, and his shoulder was in a sling. And I said, what's going on here, George? And he said, well, I finally went in and had the surgery on my rotator cuff. Finally? He said, yeah. He'd been dealing with it for 20 years and never had anything done. And I'm like, why would you put yourself through that kind of misery, you know? But it sounds like now there's an alternative, depending on the amount of tear or whatever. But
depending on the injury, you know, I mean, this is not a substitute for surgery. Some injuries will require surgery, at least for now.
If the tear is big enough,
correct.
I would imagine.
I mean, if you have a complete tear and the ends of the two ends of the tendon are 2 inches apart, there's no stem cell that is going to put it together, you know. So that patient will need surgery. I mean, but if you have a partial tear, mild to moderate osteoarthritis of the joint, all those patients respond very well to this modality of treatment.
Excellent, excellent. Well, I just want to take a moment and say thank you again to All County Healthcare for sponsoring this particular show, you and your doctors, and for bringing on professionals such as you've seen earlier and right now to be able to educate us and allow us to know what's available out there in terms of medicine, and our prior guest in terms of what's available in with assisted living or rehab facilities. So that is really, really interesting. I did have another friend as well, and again at the gym.
Okay.
And what he was dealing with was bone on bone in his knee. So his cartilage had pretty much disappeared, or it was gone. I'm not quite sure what exactly happened, but he had mentioned that he was going through the regenerative medicine to help create cartilage in his knee. And can you expound on that for us?
Absolutely. Again, moderate to mild osteoarthritis would be a good candidate. Bone on bone is referred to with as the cartilage is pretty much gone. So you really have only bone on bone, not much cartilage. Will this respond to regenerative medicine? It will. Obviously, the symptomatology will be responding much faster. Are we going to be able to reconstruct the cartilage that is lost and now is bone on bone? Most likely not. But symptomatically, the patient should have some degree of response. In the future, I see this patient responding much better, but nowadays we are not able to enhance the stem cells. So we have to live with whatever the patient has on his own without being able to culture the cells. I see in the future, perhaps 10, 15 years from now, we'll be able to multiply the cells and be able to reproduce some of the cartilage on a bone-on-bone patient.
That is really interesting. So you see that in our future,
Absolutely. Absolutely. This is already being accomplished in other parts of the world with the enhancement of the stem cells is allowed.
I see. Okay. Now, I have heard also out there that some of the stem cell therapy includes embryonic stem cells. Are you familiar with that?
Definitely. I'm very familiar. Embryonic stem cells are, this day and age, used in the United States for research purposes only.
Okay.
What we are doing in our clinic is only exclusively autologous stem cells. Autologous meaning that comes from the same patient, goes to the same patient.
I see.
There is no risk of infections, no risk of transmitted infections, that is, no risk of any malformations, no risk of rejection. So that when you use your own tissues, it's just transplanted from one side to another.
Gotcha.
So the safety is there for this type of procedures.
I see. Well, please tell our audience how they can reach you, what the name of your facility is, and telephone number, email, address, all that kind of stuff.
Absolutely. Pain Care Specialist of Florida is the name of the practice. My name is Luis Escobar, MD. We are located in Hollywood, Florida, our main office at 4350 Sheridan Street. And our phone number is 954-322-8586. You can visit us at painconsults.com, www.painconsults.com. You can watch videos of platelet-rich plasma or other interventional treatments. You can watch the show after it's posted as well.
Excellent, excellent. That is fabulous. So is there anything else that you'd like to share with us? Tell us a little bit more about maybe your background, where you've studied, how long you've been in the business. I mean...
That's a loaded question.
Well, it's only been, a couple of years, right?
A couple of years, yes. I graduated last year now. We've been practicing in Florida since 1991. I did my training in New York, Brookdale University Hospital, part of the SUNY downstate hospital, part of the State University of New York complex. Trained in anesthesiology, specialized in pain management, and now integrated in regenerative medicine into the practice. Nice. So we've been practicing for quite some time now.
Yes, yes. What made the transition from anesthesiology into what you're doing now, into the pain management and stem cell?
Well, the anesthesiology and pain management came together, the interventional pain management. So we started the practice of treating pain via interventional treatments, injecting medication, mostly steroids and local anesthetics, to areas of injury. And that works very well. It gives a lot of relief, but does not regenerate the injury. So we allow the patient to continue their own regeneration of the tissue. So it takes longer. That is as if we enhance the potential of the patient's healing prowess by injecting some of the stem cells that normally will help the healing process. In the cases that there's not enough stem cells in the area and we're able to bring in from a different part of the body, the regeneration occurs a lot faster.
I see. Now, is there any age level where you kind of say this really isn't going to work for you, or is there any restrictions?
Well, Of course, there's the normal restrictions, infections, certain diseases such as cancer. You don't want to be transferring tissues from one area to another because you could be transferring those diseases from one area to another. Age, extremes of age, you don't want to really want to do anything on the extremes of age. You want to do something that you think that is going to work. Obviously, the stem cells decrease as we age. 20-year-old is going to have much larger amount of stem cells per cubic centimeter of harvest tissue than a 90-year-old person. But even the 90-year-old person will have some stem cells in the bone marrow and the adipose tissue that we use for the regenerative treatments. So there's no contraindication as long as the patient is active and has the need to regenerate an injury. That wouldn't be a limiting factor.
Okay.
Limiting factors would be, like we mentioned before, a complete tear. It would be a waste of time for a patient at any age, unless it's aided by other type of treatments, which doesn't exclude the use of stem cells during a surgical procedure to enhance the healing process afterwards. Rotator cuff that you mentioned before, the surgery has a high rate of failure. And there's some orthopedic surgeons that now are using stem cells intraoperatively in an attempt to make the repair last longer and be more efficient and more effective.
Wow, that is very interesting. So it can be used as post-operative medicine as well.
Absolutely. It can be used preoperative, intraoperative, and postoperative to try to improve the symptomatology and or the result of the surgery, the healing process. Yes.
Yeah, very interesting. Excellent, excellent. So tell us a little bit more about what you see in the future. What do you see happening? I know that we talked about, 15 to 20 years and how, we're going to be able to clone those cells and be able to do the regenerative healing process at a greater rate. What else do you see happening in the future?
Well, hopefully we all start going more to the gym. And we improve our own reserve of stem cells. The healthier your lifestyle, the better your diet, the more viable stem cells you would have available. We recommend our patients to start improving that before we go and harvest the tissues. If you smoke, absolutely you should quit smoking. We try to implement the use of antioxidants in a healthy lifestyle. And that tends to improve dramatically the results when we use the regenerative treatments.
Wow, that's
in the future.
Yeah, but that's interesting that you brought that up. The individual's lifestyle, because I'm a big proponent of eating correctly, no smoking, occasional alcohol. A good red wine is always really good.
It's always good for the healing process.
Yes. But also exercise and being able to do that on a regular basis, because the more that you can build up that muscle or keep that muscle active, the better the bone is going to respond, and the posture and just the quality of life.
Absolutely. I forgot to mention, we do recommend our patients as well to stop any anti-inflammatories before and after we do a regenerative treatment. We do want some of the processes that happen during the inflammation, not the inflammation itself, but we want some of the tissues, cytokines, and growth factors that come with the inflammation to be present. So we don't want to stop them by using anti-inflammatories.
I see. Wow, that's interesting too. Any difficulties with somebody who's on blood thinners?
Yes, blood thinners would have to be stopped for the harvesting and the injection, and that is a normal protocol for any invasive procedure. We do that with our pain management as well. Whenever we're going to do any injections, especially if we're working on the spine, we want the patient to stop any blood thinners, because they will bleed if we don't.
Yes.
And that will cause more problems than if we didn't treat them to begin with.
Gotcha. So, what makes you different? I mean, I'm just sitting here speaking with you. I can feel a real, true compassion that you really do care about your patients and want the best for them. Tell me a little bit more about what else makes you special.
Oh, interesting. I'm just a regular guy, who would like to help my patients. Interesting that I'm very focused on finding the correct diagnosis on my patients, and that for sure will give me a much better chance of providing a good result. If we sometimes, we get lost, patients come with MRI that says this, or X-rays that say that, and the radiologist says this or that, and you may be treating the wrong issue.
Huh?
The patient, if you treating the MRI, you're treating the X-ray, you're not really treating the patient's problem. So we treat the patient.
Excellent.
We start with a focus on the diagnosis.
Well, I've got to tell you, it's been an absolute pleasure having you on our show tonight. Thank you very much for taking the time out and for educating us, the audience, myself as well. And again, Eddie, please give them your telephone number so that they can get a hold of you.
Yes, absolutely. Thanks again for the opportunity. And you can reach us at 954-322-8586. Or you can look us up at www.painconsults.com.
Well, thank you so very much. And thank you, All County Healthcare, for sponsoring this evening's session. You can reach us and see us every Tuesday from 6 to 7. Please call in. Please give us an email. Let us know that you're out there. We would love to answer any of your questions. Until next week, see you later. Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff,